Hello, come in. My name's Dr. Harvey.
Hello, nice to meet you. I'm Nicola Robinson.
How do you do? I'm
Hi
Dr.
there.
Gupta.
So this is your patient, but this is his son who's going to speak on his behalf
Okay.
this morning. So you've got 15 minutes to conduct the consultation. We'll give you a warning when there's 2 minutes to go.
Okay, lovely, thank you.
I'll just give you this.
Thank you very much. Hello, is it Mr. Smith?
Hello, yes.
And Mr. Smith.
My
So
dad,
it's
yeah.
your dad.
Yeah.
Nice to meet you both. My name's Nicola Robinson. I'm one of the trainee doctors here today. So tell me, the GP sent your dad up with a bit of trouble with his memory and things. Can you tell me a bit more about what's been happening recently?
Well, really, the last few months, my dad thinks he's getting a wee bit just lethargic, just not got much energy, not much focus, his concentration isn't great, and
Okay.
it's just been going on for the last
Okay.
months, you know.
And is it his memory as well? Has he been struggling with that too?
He thinks he's getting a wee bit forgetful with some things as well.
Okay.
Yeah.
And any other changes in him apart from mentally that you've noticed?
A wee bit unsteady.
Okay. Has he had any falls?
No.
Okay.
No.
And have you noticed that he's lost any weight or anything different?
Well, he's lost about, since it sort of started a couple of months ago, I'd say about 1 kilogram.
Okay. Fine. Fine. And any other symptoms he's had? Coughs or colds at all? Has he complained of that?
No.
No. And any fevers or night sweats, anything like that? No. Any palpitations or flutterings of the heart that he's complained of, or pains in the chest?
No.
No. And any abdominal symptoms recently?
Well, my dad said, he said a wee bit of sort of indigestion sort of
Okay.
problems, you know, in the last, say, couple of months. You know.
Okay. Has he been taking any medicines for that at all?
Well, went to the doctor and prescribed omazepam or something like that. Omazepam, is that what it's called?
Omeprazole?
Omeprazole.
Okay.
Yeah, he's been taking that to sort of try and help his heartburn.
Okay.
Yeah.
And does he take any other medicines at all?
No,
No.
no,
No, just that one.
just that
Okay.
one.
Fine. Is he allergic to anything that you know of as well?
No.
Okay. And in addition to the heartburn and indigestion he's had, any diarrhea or constipation?
No.
Okay. Right. Okay. Have you noticed his tummy bloating out at all?
No, I can't say
No.
I've doctor, no.
Okay. Fine. Has he had any shakes in his hands, or have you seen any shakes of his body in
No.
total? Okay.
No, I've seen that,
And has he complained of headaches recently?
no.
And has he had any trouble with passing urine? Any problems passing urine? Any trouble with the waterworks?
No.
Any discomfort that he's complained of?
No, he's been fine.
Okay.
Yeah.
And no blood in the urine or anything like that?
No.
And he's definitely not said about blood in the stools either?
No,
Or change in colour of the stools?
no, I mean, in the past, my dad, a good couple of years, 2-3 years ago, there was blood present, and we went up and we got it checked out, and we sort of checked out, there was a sort of diverticular disease,
Okay.
and there's a polyp as well.
Okay.
So they removed the polyp, and you know, that was it. That was about 3 years ago.
And was that just done with a camera test, or did he need it?
it's
Did he need any more
endoscopy.
operations?
Yeah,
Okay.
endoscopy.
Fine. And has he been in hospital for any other reason recently?
No.
No. Is there anything else he sees the GP for usually?
No, not really. No, it's no, it's okay. Not too bad.
Okay, fine. Fine. And at home, is it the two of you at home, or does he live by himself normally?
It's my dad and my mum.
Okay.
You know, I'm out of the house. You know what I mean? So, yeah.
Okay. And do they normally manage fairly well, the two of them? And recently, have things been more difficult with the changes in his memory and forgetfulness and things?
I think it's just a combination, just not feeling quite right, you know,
Okay.
just the tiredness, just not being focused, just
Okay.
not being, you know, concentrated.
Okay.
You know, and there's something in memory combined with that as well, just something not feeling quite right.
Okay. And does he smoke at all?
No,
Has he ever smoked?
no.
Does he drink any alcohol?
Bottles of beer now and again, if he's out and about, we don't want him, it'll just.
Okay. Do you think you could? Is he drinking every day? Is it a few bottles every day?
No, more a social thing. If he's out with my wife, have a bottle of beer, a couple of bottles of beer. I mean, over a week, I would say, what, 3, 4, 5 maybe.
Okay. And has he ever used any drugs at all? Any illegal drugs?
No.
No. Okay. Good. Fine. Is there anything you're particularly concerned about, or he's been mentioned to you in the past recently?
He's got a couple of concerns. He's been saying the wee bit worried. Could this be the cancer? And cancers things like with the bowel thing going on about 3 years ago.
Okay.
The polyp was removed, but could there be something going on there? Is there a dementia thing element?
It's difficult to know just at this stage. We've still got a few more tests and things to do. I'll have a look over them in just a minute, and we'll see if we can work through things. But we'll come up with a plan at the end.
Right.
Okay. Is there anything else you want to ask just now before I have a quick look over them?
Not really, Doctor. Like I say, it's just a wee bit worried about what's actually what's causing this, because there's something serious going on in the background, and just to get it checked out and how he gets it checked out.
Okay. Fine. Fine. I'll come back to you when I've had a look through everything. Okay?
Yeah.
Right. Hello, Mr. Smith.
Hi.
How are you feeling?
Fine.
Do you mind if I have a look over you? My name's Dr. Robinson. I didn't quite introduce myself when I came in. Good. Let's have a look at things. Okay. Can you pop your tongue out for me? Good. Good. Lovely. Okay. Can I get you to do me a favour and turn your head to that wall? Okay. Any pains in your tummy?
No.
No? Okay, good. Right. Can I sit you forward a bit? Would we manage that? Just be very careful on the chair. Okay, I just need to have a feel of the lymph nodes in your neck there. Okay. Good. I'm just going to tap on your back if that's okay. And a quick listen in as well. And out. And again. And out. Okay, lovely. Can I get you to lie back just gently? I'm going to have a quick listen to your heart, and then we might have to pop the table down. Right, I need to lie the bed down a little flatter, so if we shuffle you forward just a little bit. Okay, right, take your time. Good. Is that comfortable?
Yes.
Okay. Do you mind if I shuffle this down a little further? Good. Okay. Any pains in your tummy?
No.
Sorry. That would be lovely. Thank you. Okay. Okay, good. Right. Okay, take a deep breath in for me. And out. And out. And again. And out. And again. And out. And again. And out. Good. And again. And out. And again. And out. And again. And out. And again. And out. Good. Okay. Look at the ankles. Nice and slim. Good. Okay, brilliant. Do you mind if I sit you back up again? We'll just take your time. Well done. Good. Okay, that's lovely. Good. Fine. Good. You happy enough there? Are you comfortable?
Yes.
Good. Okay. Right. There's not much to find to examine your father at the minute. We need to run a few extra tests, so we'll start with a few blood tests first of all. We'll get a chest x-ray and we'll see how things go. I think the sodium level that the GP had was very low. We're worried about there's a whole host of things that can cause this. I wonder if it's been the recent tablets he's been taking, the omeprazole tablets for the indigestion, that's caused all this trouble, but there is always a concern that this might be due to something else. There are a lot of problems in different glands around the body that can cause a low sodium, and we need to do a little bit of working out what that is over the next little while. So we'll get some blood tests, a urine sample, a chest x-ray, and we'll work from there. Okay?
Okay, no, yeah.
Good. Have you any questions or anything else that you wanted to ask?
No, so in terms of, you'll do some tests and let us know what's panning out.
Yeah. Yes, so I think we probably need to see the blood test. If his salt level is still very low, given that he's been confused, we might keep him in the hospital just if it is dropping further until it comes back up. Okay. As I say, there can be some serious reasons for this, and we might be able to get to the bottom of this a bit faster. Okay.
So, is there anything, could there be anything with my dad's related to cancer? Could there be something?
It is possible. As I say, there are a number of things that can cause the salt level in the blood to drop. The most common things tend to be medicines that he's been on, like the omeprazole tablets. We need to stop that and restart it and restart something different in its place. We give him a tablet called ranitidine, which is a slightly different tablet to take twice a day, and hopefully that would get on top of the symptoms. Cancers can cause this, and that's why we're going to do a few blood tests to start with, and urine tests as well as the chest x-ray to see if there are any abnormalities within those. And we'll see what the results of those show before we do anything extra at the minute. Okay. It sounds like he's had this for some time in the community and has been managing relatively well, although he has been a bit more muddled and slightly confused. He's not had any dangerous symptoms. He's not had headaches or seizures by the sounds of things. And if we can rectify this, the sodium level should come up nice and slowly. Okay.
And that could possibly be impacting on
his memory, absolutely, exactly, and the fatigue. So all the glands in your body and the muscles in your body and everything doesn't work quite as well when your sodium level is low. So as that comes up nice and slowly, he should get a bit more energy and feel a bit more himself, and his memory should hopefully return back to normal. It's difficult to say at the minute with the sodium this low if that's the only thing causing trouble. We don't know if he might have, if his brain is just getting a little older.
You've got 2 minutes left.
Thank you. If his brain is just getting a little bit older and this low sodium has made it a bit more difficult for it to function.
Right, okay. And this, did you say this could just be a reaction to
this tablet? Yeah, absolutely. It's one of the relatively common side effects. But we'll keep a close eye on things over the next little while. I want to see what the blood tests look like today before he goes home. And they normally take about an hour or so to come back. So we'll see what the blood tests look like. And if they're dropping further, we might need to keep them in the hospital for further tests, just to make sure they're coming up nicely. Okay.
Right, so you're just going to observe him for a wee bit longer, then we'll see if he's going to go home and stay here. Right, okay. Anything I can do? In terms of just now?
No, so I think if anything happens, if we do let him home later today and he gets much worse, we would want you to bring him back into the hospital or up to see the GP, but certainly back into the hospital if he had any seizures or anything very worrying, or he became incredibly unsteady on his feet.
see. Okay. I'll keep my eyes open for that if there's anything.
Okay.
You know,
Fine. Absolutely, and you can tell your mother as well, just if she's the one looking after him most of the time, if she's any worries or concerns, make sure he gets medical attention.
Yeah, of course. Yeah. Okay. Okay, doctor, like I say, I'll just wait for these tests and hopefully, get it all clear.
Good. Okay. So
Okay, that's time up actually. So.
thank you very much.
Thank you. So you actually explained to Mr. Sun quite a few of your findings, but maybe if you could just summarise them for me. First of all, what physical findings did you elicit?
This gentleman's euvolemic, so he's warm peripherally, his pulse is 80 beats per minute and regular, his chest is clear to percussion auscultation, he's no evidence of heart murmurs, he's no lymphadenopathy cervically, he's no organomegaly or any signs of masses in his abdomen. Clinically, he's euvolemic, he's got no pedal edema, and his JBP is not elevated.
Okay, so did you find any abnormal signs at all?
No, none at all.
No. Okay, so he's euvolemic and hyponatremic. So based on that physical examination and also the history that you've elicited, what diagnosis are you thinking about at this stage?
I'm concerned about a variety of things. Probably most likely in him is omeprazole-induced hyponatremia. I'd be worried about SIADH or an underlying malignancy causing a drop in his sodium.
Okay. Is there any other important diagnosis you think you need to consider here? So,
Adrenal insufficiency as well.
okay. So, and of those, which do you think is the most important? Which is the most likely, and which would be perhaps the most important to exclude?
The most likely is probably the omeprazole, given that the timescales are roughly similar. But malignancy is obviously the most important to exclude during the investigations.
Okay, so you've outlined a little bit already what your plan is, but can you just again tell me what are you actually going to do now in practice?
So we'll undertake a variety of blood tests, so looking at
specifically?
So full blood count, urea and electrolytes, liver function tests, cortisol.
So why are you measuring the cortisol?
To see if there's any signs of adrenal insufficiency.
Okay, right.
If that was, ideally measure it first thing in the morning, but if that was low, then do a short synaptin test as well.
Fine. And how would you go about establishing diagnosis of SIADH? Clearly, that's a biochemical diagnosis with a number of causes, but how would you actually establish that?
So using both urine and serum osmolarities as well as urine sodium as well.
And what would you be expecting to find?
A urine sodium of over 30 and a mismatch between the plasma osmolarity and the urine osmolarity. So a very low plasma osmolarity and a higher urine osmolarity.
Okay. And you mentioned about the cortisol, you say that's diagnosing potential adrenal insufficiency. So do you need to measure the cortisol for the SIADH?
Yes.
Why?
Yes, to see if there's if the kidneys are not functioning quite as well as they have done.
It's a diagnosis of exclusion, isn't it? Yeah, so it's a specific cause. So you're worried about malignancy. What sort of malignancies are you really thinking on top of your list here?
Gastrointestinal malignancy, so he's already had a colonic polyp removed and he's had a lot of indigestion, so you'd be worried about gastric cancers as well. He's a non-smoker, but lung cancer could cause...
So what's your strategy to exclude it then?
So see what the blood tests look like, but either upper and lower GI endoscopies as well as CT scans, depending on if things improve or not.
And the lung malignancy?
Chest x-ray as well.
Yeah, okay, fine. Why do you think he's confused?
It may be a combination of things, probably the low sodium, but this may be revealing an underlying dementia or cognitive impairment, but it'd be difficult to say that with a sodium of 120 at present. So I wouldn't say that until he's started improving. Ideally, I would like to do some sort of mental state examination on him.
Right. So if his sodium improves but his confusion doesn't, what would you be thinking about next?
Further CT head for that.
Right, looking for
any space occupying lesions or evidence of metastases, depending on what else we find
his son was obviously quite concerned about the possibility of cancer, which we've spent a lot of time discussing. So how did you manage that, do you feel, in terms of acknowledging that possibility but without frightening him?
Okay. I think it's a very real possibility, but there are many other causes of low sodiums that we need to exclude. First of all, it's difficult to say at this stage, and that's why we're undertaking a variety of investigations, and we'll arrange for regular review of him until his sodium is normalised, until we've come to the end of our investigations,
Okay, I think
depending on
that's...
what we get.
Okay, thank you very much.
Thank you.